Welcome in this hematological section of physiology, human physiology. I am Dr. B.K. Prasad before you. Today chapter is hemoglobin. This is in continuation with my previous lecture, that was hemoglobin. So from that, if you have not seen, then please see that one hemoglobin has 4 haems with 4 ferrous iron, and one ferrous molecule binds one oxygen molecule, that is 2 oxygen atoms. So one hemoglobin molecule carries 8 atoms of oxygen. One hemoglobin, that is 4 haems, one hemoglobin, 4 haems, one haem, one ferrous iron, and one molecule of oxygen, that is 2 atoms of oxygen in there. Average value of hemoglobin: newborn 16 to 20 gram per deciliter, infants 22 to 23 gram deciliter. At the end of 3 months, it becomes 10.5 gram per deciliter. At the end of first year, it is 12.5 gram per deciliter. Adult male 14 to 18 gram per deciliter. Adult female 12 to 15 gram per deciliter. After menopause, it is 14 to 18 gram per deciliter as males. And due to some hemoglobin present in dissolved in blood. Due to this dissolved hemoglobin, blood is red. 1 gram hemoglobin carries 1.34 milliliter of oxygen. 1 gram hemoglobin contains 3.4 milligram of ferrous iron, and 1 gram hemoglobin contains 574 amino acids. Clinically 14.8, say 15 gram per deciliter is 100% hemoglobin. So in 15 gram hemoglobin contains 1.34 milliliter into 1.34 milliliter, that is 20 milliliter of oxygen, 20 milliliter per deciliter of blood, as 15 gram is present in 1 deciliter. Functions: what are the functions of this hemoglobin? Carry oxygen from lung to tissues, carry carbon dioxide from tissues to lungs, nitric oxide from lungs to tissues, antioxidant. It functions as an antioxidant buffer and regulates iron metabolism. Configuration of hemoglobin molecules. There are two forms: tense. In deoxygenated form, when hemoglobin is deoxygenated, hemoglobin-globin chains are bound in tense configuration. Therefore, they are combined with tense and have low oxygen affinity. High partial pressure of oxygen in lung causes binding of this will enter into this tight configuration. It will enter into the tight configuration due to increased partial pressure, high partial pressure of oxygen. And first oxygen molecule is attached. After that, binding of it becomes loose, slightly loose, and then second oxygen molecule will enter, and this goes into relaxed configuration with increased oxygen affinity, and therefore the third molecule of oxygen will enter with it, and fourth oxygen will also enter in this with very ease. This is relaxed configuration, and this shift promotes oxygen binding cooperative process responsible for sigmoid shape of oxygen dissociation curve. When oxygen is absent, a weakly bound water molecule fills the site, forming a disordered octahedron. When oxygen is not there, then a weakly bound water molecule fills the site, forming a distorted octahedron. Hemoglobin is a protein and negatively charged combined with proton, therefore it works as a buffer. This is about hemoglobin. Now hemoglobin is also present in RBC, large amount, then slight amount is in dissolved form in blood plasma. Then it is also present in dopaminergic neurons in the substantia nigra, hepatocytes, alveolar cells, mesangial cells, cervical cells, vaginal epithelial cells, macrophages. Here it works as regulates iron metabolism, and second is oxygen supply to some extent. Then fate of hemoglobin. What is the fate of hemoglobin? In tissue macrophage system, previously called reticuloendothelial system, these RBC, senile RBC, old RBC, or damaged RBC are destroyed in the tissue macrophage system, liberating hemoglobin and tissue product. This hemoglobin is broken into heme and globin. Heme is carried to the CD163 hemoglobin transporter on macrophage only. This is only present on the macrophage and degraded there. In the macrophage, this is degraded there in iron and porphyrin. One molecule of carbon monoxide is liberated in degradation process of hemoglobin. This is the source of carbon monoxide in normal breathing person. Then iron. What is fate of iron? Iron is utilized to form hemoglobin. First. Number 2, it is carried by transferrin, beta globulin, and stored in as ferritin or hemosiderin in liver. In liver, it is stored as ferritin and hemosiderin. Now, porphyrin is chain structure, and this is a straightened chain. Chain becomes a straight. Biliverdin reductase reduces it to form bilirubin. In liver, it is conjugated, becomes water soluble, and goes into the small intestine. In a small intestine, urobilogen is formed. Some urobilogen goes into the enters into the liver through intraportal circulation, through intrahepatic circulation, and some are absorbed and excreted in urine, where it is oxidized to form urobilin, and some in a stool oxidized to form stercobilin. Due to stercobilin, color of a stool is yellow. And globin is broken down into amino acid, and these amino acid will enter into the amino acid pool, forming, and then from there they are used to form protein. Okay, thank you very much. It is something about hemoglobin, and I think this will help you. This will help you to increase your knowledge, and if you enjoyed it, then like it, follow it, and subscribe the channel. Thank you very much.